Hey guys, it's Ana Dolaskie. 12 years ago, ACSH released a video explaining that vaping is dramatically safer than smoking.
E-cigarettes, more are turning to electronic cigarettes.
In it, I explained that this is primarily because it avoids combustion and the carcinogens in tobacco smoke. So how does that message hold strong today, more than a decade later?
I'd say that video is prophetic in that it's exactly correct. Most estimates you'll see are somewhere between 95 and 99% safer. As Dr. Ross said in the video, it's because most of the carcinogens that are in tobacco smoke are just not present. Because the biggest threat to your health is the combustion, it's burning the tobacco. And since vaping devices vaporize, hence the name, there's no burning. There's very little there that can injure your health, and the research reflects that really clearly.
Long-term studies show no significant new harms emerging, especially for adult former smokers who switch. Public perception has also shifted.
So it's interesting when watching back this video that we made 12 years ago, we used the term e-cigarettes or electronic cigarettes. I don't believe there was a time that we referred to it as vaping, which is now just the most common term. How do you think that has changed the perception?
I think it has changed in that it differentiates it from tobacco. I think one of the challenges is it's not the people that are using the products that are always defining the terms of the conversation, because you have a very big lobby effectively of nonprofits and even academic scientists and even government agencies that are trying very hard to poison the conversation effectively, because they don't want people using these products. And so if you distort people's understanding of this topic, you're putting them in harm's way, and that's why this conversation is so critical.
English says the conversation is hyper-focused on youth vaping, but evidence suggests that teen vaping is trending down.
Teen vaping is at a record low, and this is an awkward fact that the media doesn't really like to talk about. They will report the numbers in obscure ways, so it's hard to understand. The CDC and the FDA do this as well, so there's always going to be some underage use, and you take practical steps to mitigate that, right? We do this with alcohol, right? It's widely available across the country, but you can't buy it without ID.
In fact, the FDA stopped calling youth vaping an epidemic in 2023 once teen vaping dropped dramatically. The latest data from the CDC and the FDA show vaping use decreased from 2.13 million youth in 2023 to 1.63 million youth in 2024.
Switching from smoking to vaping isn't just about reducing risk, it's also about improving your overall physical health.
Dr. Chuck Dinnerstein, for example, has described vaping as an intervention. It's a quit smoking intervention for adults. There's all sorts of stories, and these are more touching and more promising than these boring academic papers that people read, right? You'll see a grandmother who smoked for 50 years and she says, I can breathe again, I can run at the park with my grandchildren, and it changed my life, right? And so that's the story that needs to be told, that people are not dying and they're living higher quality lives as a result of this. So as an intervention to get people off cigarettes, yes, it's a very, very significant step forward.
For more science and health facts, including our coverage of nicotine vaping and your health, like this video and subscribe to this channel and visit our website, acsh.org.